Question 41. 8-month-old child diagnosed with bronchiolitis due to the respiratory syncytial virus, RSV, is admitted to the pediatric hospital. The nurse should initiate which of the following isolation precaution? A. Contact. B. Airborne. C. Standard. D. Droplet. Answer 41. A. Contact. Question 42. A 5-year-old child is seen in the primary care clinic with mild fever, headache, and malaise for about 2 days. Today, he has a rash filled with fluids. Which of the following is the best suggested diagnosis? A. Chickenpox. B. German measles. C. Measles. D. Scarlet fever. Answer 42. A. Chickenpox. Question 43. An 8-year-old boy is presented to the pediatric clinic with his mother, who complains that the child has developed a skin rash. There is a clear drainage from the nose and he appears tired. The rash first appeared on the face and then spread over the trunk and is now beginning to appear over the hands. Some lesions show open ulcerations and others have crusted over. There are scratch marks over the skin. Which finding would indicate the child is ready to return to school? A. Normal body temperature. B. Dry and scabbed lesions. C. Nares of free drainage. D. Absence of rash over trunk. Answer 43. B. Dry and scabbed lesions. Question 44. A patient with measles, rubella, is on airborne precautions. Which of the following precaution techniques would be essential to implement for non-immune persons entering the room? A. Gloves. B. Gowns. C. Masks. D. Face shields. Answer 44. C. Masks. Question 45. A home health nurse has entered a home to complete an admission assessment on a patient who has a methicillin-resistant Staphylococcus aureus, MRSA, urinary tract infection. The patient will receive intravenous anti-infective via a peripherally inserted central catheter, PICC, for 3 weeks. Which of the following actions should the nurse take first? A. Shake the patient's hand. B. Place the nursing supply on a clean, dry surface. C. Obtain the patient's written consent for home health care. D. Perform hand hygiene per the agency protocol. Answer 45. D. Perform hand hygiene per the agency protocol. Question 46. You have just admitted a patient with bacterial meningitis to the medical surgical unit. The patient complains of a severe headache with photophobia and has a temperature of 102.6 Fahrenheit orally. Which type of isolation should be suitable for the patient? A. Airborne. B. Contact. C. Droplet. Answer 46. C. Droplet. Question 47. In order to reduce the risk of disease transmission from a patient with diphtheria, which of the following standard precautions would the nurse implement? A. Airborne. B. Contact. C. Droplet. D. Ventilatory. Answer 47. C. Droplet. Question 48. A patient with a colostomy complains of itching of the peristernal skin. On assessment, the skin is covered in a red rash with white patches visible. What is the most likely cause of this condition? A. Not changing the pouch regularly. B. Candidiasis. C. Consuming acid-producing foods. D. Dehydration. Answer 48. B. Candidiasis. Question 49. A 33-year-old woman has come to the outpatient clinic for treatment of a vaginal infection. Physical assessment reveals yellowish excessive, thin offensive, and frothy discharge. Which of the following is the most likely diagnosis? A. Candidiasis. B. Trichomoniasis. C. Bacterial vaginosis. D. Chlamydia. Answer 49. B. Trichomoniasis. Question 50. A 5-year-old child is seen in the primary care clinic with headache, malaise for about 2 days, and today he has blisters filled with fluids. For how long should the child be isolated? A. 2 days. B. 6 days. C. 10 days. D. 15 days. Answer 50. B. 6 days. Question 51. A toddler is seen in the emergency room with a history of high temperature for 5 days. He had watery eyes and a cough for the last 3 days, and then he developed a rash all over the body, which started in his face and spread down to his body. The mother did not remember the vaccination schedule of her son. For how long should the child be isolated? A. 5 days. B. 10 days. C. 15 days. D. 20 days. Answer 51. B. 10 days. Question 52. The nurse is assessing a 65-year-old patient who reports the fatigue, weight loss, night sweats, and a productive cough with thick sputum. The nurse should immediately initiate isolation precautions for which of the following? A. Influenza. B. Pertussis. C. Bacterial pneumonia. D. Pulmonary tuberculosis. Answer 52. D. Pulmonary tuberculosis. Question 53. Which of the following diagnostic tests is definitive for TB? A. Chest X-ray. B. Monteau test. C. Sputum culture. D. Tuberculin test. Answer 53. C. Sputum culture. Question 54. A patient is presented with high fever, headache, vomiting, and neck stiffness for the past 3 days. Which of the following is the first diagnostic intervention for this patient? A. Urine and stool analysis. B. Lumbar puncture with CSF aspiration. C. Complete blood count. D. Chest and abdomen X-ray. Answer 54. B. Lumbar puncture with CSF aspiration. Question 55. When a patient is admitted with acute influenza, what type of isolation is most appropriate? A. Reverse isolation. B. Contact isolation. C. Strict isolation. D. Respiratory isolation. Answer 55. D. Respiratory isolation. Question 56. What precautions are necessary when caring for a patient with hepatitis A? A. Gowning before entering the room. B. Wearing gloves for direct care. C. Wearing a mask at all times. D. Placing the patient in a private room. Answer 56. B. Wearing gloves for direct care. Question 57. The nurse is assigned to care for a patient with Ebola virus disease. Which of the following is the most common mode of transmission for Ebola virus? A. Vector. B. Airborne. C. Direct contact. D. Common vehicle. Answer 57. C. Direct contact. Question 58. A nurse is caring for a patient diagnosed with pulmonary tuberculosis, and she has to wear N95 mask when she enters the patient's room. Based on the cycle of infection, Which of the following is the reason to use the mask? A. Break the transmission chain at the portal of entry. D. Break the transmission chain at the portal exit. C. Kill the agent existing in the patient's room. D. Eliminate the reservoir of the bacteria. Answer 58. A. Break the transmission chain at the portal of entry. Question 59. After receiving the initial treatment of TB, a 27-year-old woman in the chest disease ward was given discharge instruction on dietary management, medication, regimen, hygiene care, and follow-up visits. What is the instructions needed to be emphasized the most? A. Increase protein diet to promote healing. B. More rest and relaxation to restore therapy. C. Maintain daily exercise schedule to improve health. D. Dispose sputum as guided to avoid spread of disease. Answer 59. D. Dispose sputum as guided to avoid spread of disease. Question 60. A patient is admitted to the emergency room with an unknown infection disorder. Which of the following is the most important measure a nurse should implement to reduce the risks of transmitting these microorganisms to another? A. Hand hygiene. B. Wearing gloves. C. Wearing a mask. D. Wearing a gown. Answer 60. A. Hand hygiene.